Individuals with cardiovascular disease can be taken a variety of medications. Diuretics are the first line of treatment for hypertension, and if you have a client taking a diuretic for hypertension, you have to consider the negative effects of this drug class on exercise. The goal of diuretic therapy is to decrease water reabsorption and to increase water excretion by increasing urine output. This will decrease blood volume and hence will decrease blood pressure. Diuretics act in the kidney, and their main action is to inhibit sodium and chloride reabsorption. Since water follows sodium by inhibiting sodium reabsorption, water is not reabsorbed, and more water is excreted in the urine. As mentioned above, this decreases blood volume and lowers blood pressure. The body usually compensates for this, and blood volume will eventually rise. The long-term effects of diuretics is likely due to a reduction in peripheral vascular resistance. And when peripheral vascular resistance decreases, blood pressure decreases. If your client is a runner and they are taking a diuretic, you need to think about the impact of the drug during exercise, particularly in warmer weather. During exercise, the body is constantly shifting blood flow from the exercising muscles to the skin to dissipate heat. And this is done through vasodilation. As the vessels open near the skin, they let off heat. Diuretics impair the body's ability to dissipate heat through peripheral vasodilation. The body's normal response to a low blood volume is to increase peripheral vasoconstriction. Now remember, vasoconstriction increases peripheral vascular resistance, which increases blood pressure. Diuretics will lower blood volume, and this impairs thermoregulation because it inhibits peripheral vasodilation, diminishing the body's ability to let off heat. Decreased blood volume minimizes sweat loss, which further impairs thermoregulation, which can impair exercise performance and exercise duration. It's unclear how much the long-term diuretic effect of a reduction in peripheral vascular resistance impacts exercise.